progesterone is a very reliable and objective measure of ovulation, and it is done 1 week prior to the expected onset of next menses rather than on any one specific day, that is on day 21. We are not supposed to do luteal progesterone on day 21. Rather, we'll do it 1 week prior to the expected onset of next menses. So if the patient has 37 days cycle, so we have to do the luteal progesterone on day 30 of the cycle. If the patient has 28 days cycle, then we have to perform it on day 21 of the cycle. So why is it so? Why we are not performing on day 21 in a 37-day cycle? As there is intra-cycle variation in the serum progesterone. If we are doing immediately after ovulation, then it will be sufficiently low, and just before menses, and it will also, the level will be low. So will not reach a conclusion that the ovulation has occurred or not, and it will give a false negative result. The progesterone concentration more than 3 nanogram per ml is it sufficient evidence for the recent ovulation. Let's discuss another test, which is the ovulation testing kit. It is the ovulation testing kit, which is now very common to know the fertility period. So, LH testing kit, also known as ovulation predictor kit, is used to identify the mid-cycle LH surge. Why we wanted to know the mid-cycle LH surge? Because if we identify the mid-cycle LH surge, we know that the ovulation occurred within 24 to 48 hours after the LH surge. So, what all instruction you need to give to the patient while performing the urinary LH kit test? So we will advise the patient to avoid drinking large volume of fluid in short interval of time before they are planning to do the test. And we should also ask the patient that generally we will, for any test, for example the UPT test, we'll ask the patient to do it in the morning as the urine is most concentrated in the morning. But in this case, we are not supposed to tell the patient to do it on the first morning void sample, because the urinary LH, the urinary LH will be correlated with the peak in the serum LH. So the blood LH surge often begin in the early morning hours, and they are not detected in the urine for several hours. So for example, the urinary LH will rise after the blood LH. So the blood LH level will rise in the morning. So the effect on the urine will occur at the time of evening or midday. Hence, this test is not usually performed on the first void urine, and it is usually performed midday or evening urine sample. Let's now discuss what is false positive. As we all know that in PCOS patient, there is tonic elevation in basal LH level. So it will give rise to false positive results. And how is it useful? How ovulation predictor kits help the patient? So if the couple are living in different states, for example, one couple is in Delhi and one couple is in UP, and they have little time together. So they wanted that they'll do the sexual intercourse in the fertile period, and which is predicted best by the ovulation predictor kits, as when there is two line in the kit, that means LH surge has occurred and the ovulation will occur within 1 to 2 days. So we'll ask the patient to do the sexual intercourse part in that period, that is after the LH surge. False positive test can occur in 7% of the cases. Let's now coming to the other modality, that is transvaginal ultrasound. Transvaginal ultrasound is a very useful tool, and it provides provide detailed information about the size and the number of pre-ovulatory follicles, and also help to estimate when the ovulation occurred. And also, when we do it in the luteal phase, it will tell us that the ovulation has occurred or not, as we'll see if the follicles collapse, the margin become indistinct, and there is fluid in the pouch of the dress. These all will represent that the ovulation has occurred. But it is very time consuming and costly, so every patient cannot afford this. So it is a little inconvenient for the patient. Let's see the photo. This is the photo, this is the picture showing ovary with the dominant cyst. The next picture is of the ovary, which show the follicles which has collapsed. That is, ovulation has been occurred. As you can see in this picture, margins become indistinct. So this is typically the sign of that the ovulation has occurred in this setting. After the ultrasound, let's do the basal body temperature. Let's learn about the basal body temperature, which is not usually done nowadays. So what is basal body temperature? So it is the temperature under basal condition at rest. So how will you tell the patient to do the basal body temperature? You will ask the patient that each morning after waking up, before arising from the bed, she should take her temperature. And it is based on the principle that in the luteal phase, under the effect of progesterone, because as the progesterone has thermogenic effect, there is increase in the temperature. So we can see that it is very tedious test and unreliable, doesn't predict the ovulation very well, and we cannot accurately predict timing of ovulation, and it is thus not recommended for assessing the ovulation function. So we'll see what is biphasic BVT and what is monophasic. So this graph, in which you can see the purple arrow, that purple graph, that is the body temperature variation during a menstrual cycle. So you can see in the proliferative phase, that is follicular phase, the graph is toward the lower side. And in the luteal phase, the graph is toward the higher side, as we have discussed that the progesterone has thermogenic effect. So you can see there are two phases in the graph, that is why it is known as biphasic curve. So it is very tedious process to measure basal body temperature daily. It is not recommended to use this test. Now coming to the historical test, that is endometrial biopsy. It is performed in the luteal phase, and an anovulatory woman were always in the follicular phase. That is, if you are taking biopsy, endometrial biopsy, on premenstrual phase, it is done during the luteal phase, that is premenstrual phase, and we'll find that the endometrium is proliferating. Ideally, it should be secretory, but it came out proliferating. It means that the ovulation has not occurred. If the report is secretory endometrium, implying that this cycle was ovulatory. It was used historically for luteal phase defect also. How it is used for luteal phase defect to identify the luteal phase defect is, if the endometrial biopsy was done on day 21 and it show the histological changes corresponding to the day 20 or day 19. That means the difference is less than 2 days, means that the luteal phase is fine. But if the difference is of more than 2 days, if the histopathology show that it is of 15th day, day 15, but we have done it on day 21, that is a difference of 6 days, it means luteal phase is defective. And the diagnosis of luteal phase defect has been made historically by this method, but it is no longer used for routine infertility evaluation, and it lacked both accuracy and precision, and the whole cycle of the woman get wasted it is not recommended. So this is the end of the important topic, that is test for ovulation. I hope you enjoyed. Thank you.